Thank you very much for agreeing to take part in this interview, which we call 10 Minutes with ILPN. And could you just shortly introduce yourself?
My name is Naoki Ikegami. I'm Emeritus Professor at Keio University, Tokyo, Japan.
Mm-hmm. And could you just explain to a lay person what it is that you're doing?
I have studied health policy and long-term care in particular.
Mm-hmm. How would you describe long-term care in Japan? What services it covers and for whom?
There's public long-term care insurance for all residing in Japan
Mm-hmm.
who are over the age of 65, and for those 40 to 65 who have an age-related disability, such as dementia or strokes, for example.
Mm-hmm. And in terms of services that it covers?
It's according to the eligibility levels. The eligibility levels entitles the person eligible to a cash equivalent amount of services of US up to $3,000 per month.
Mm-hmm.
And out of this maximum of $3,000, they are able to pick any service they would like, for which they pay 10% out of pocket, but the rest is covered by insurance.
Again, is there more emphasis on specific services in terms of home care services or residential care or?
As a percentage of those who are receiving services, because the community services are numerically more, but since the amount they spend is less, the amount actually paid for by long-term care insurance is more for institutional care.
Okay. What would you say are the three main priorities for long-term care in Japan? Policy priorities.
Well, the policy, we have the oldest population in the world. The percentage of those 65 and over is over 1/4 of the population. And this will increase to 40%, close to 40% at its peak in around 2040. So just by maintaining the status quo of the service level will be a major challenge because of the aging population.
And what would you say in terms of research priorities? What's the outstanding piece of research in terms of long-term care in Japan that you think needs to be carried out?
Well, as I said, the greatest priority is to maintain the current service level because the services have been quite generous. But whether we can still afford to be generous at that level when with increasing aging of the population, that is the greatest policy challenge.
And in terms of research challenges or research priorities?
Well, getting access to good data is, for researchers, the greatest challenge. Because the eligibility, the assessment data used for eligibility is not made available for research. And the eligibility assessment items are homegrown method. So it will be difficult for us to cross-validate with other more generic measures of disability, for example.
And going back to the policies for long-term care, is there any policy, if you were to introduce just one policy in long-term care in Japan, what would that be?
Well, it's difficult to come out with just one. I think we need to re-establish what is the cutoff point between residential care and community care, because the division is somewhat artificial. The residential care or institutional care is when you get two bills, one for the hotel services, one bill for the hotel services and one for the care services. Whereas in housing, you get two bills, one for the hotel services and one for the care services. But the distinction has become very blurred because the government has tried to restrict the number of institutional, definitely institutional care settings. So as a result, there are long waiting lists to get into residential care. Now, this excess demand has been filled by what is so-called specialized housing. But specialized housing, which may have a home helper agency and a visiting nurse agency on the ground floor and possibly a daycare center also, that is very close to a nursing home or residential care environment. So where to draw the line between these which are technically categorized as housing and those which are technically categorized as residential institutional care, it will become even a greater issue in the future.
Okay, well, I'm going to ask you a few quick questions now, and I'm looking for a number of responses from 1 to 10, where 1 is low and 10 is high. So the first one, what would you say is, what policy priority is allocated to long-term care in Japan?
Well, I am biased, but my impression would be 8.
Okay. And how do you think, how aware is general public about what the long-term care system offers to them?
But 6.
Okay. And how do you think how well the system supports people with long-term care needs?
7.
7, okay. And how well the system supports their needs of carers?
6.
6, okay. And the last one, how integrated are social care and healthcare in the service delivery in long-term care?
4.
4, okay. Well, thank you very much. That was my last question. I appreciate you taking the time to talk to me this morning.